Hello, everybody, and welcome to our new COVID-19 interview series called Rising to Meet the Moment, where we engage with stakeholders to discuss how different aspects of the behavioral health system are responding to COVID-19 and rising to meet the moment. I'm Kevin Riggs on behalf of the Behavioral Health Action Coalition, whose mission is to engage California leaders to prioritize behavioral health issues and to reduce stigma. I'm joined today by Cherie Lowe, a Vice President for the California Hospital Association, one of BHA's co-founders, and also Ondra Clark Harvey, the Director of Policy and Legislative Affairs for the California Council of Community Behavioral Health Agencies. Glad to see both of you. Thanks for your time.
Happy to be here. Thank you.
Let's start with the impact. For the benefit of our viewers, CBHA is a statewide association of more than 70 nonprofit agencies and businesses serving more than 500,000 children, youth, and older adults in California who live with mental health and substance use disorders. Ondra, let's start a little bit about the impact that you're seeing that COVID-19 is having on those nonprofit agencies and businesses that you work with. What's the impact been like?
Well, like many other healthcare industries, the COVID-19 pandemic threatens the very fiber of the behavioral care delivery system, and in turn, the safety net that provides critical behavioral health services to hundreds of thousands of Californians who our members serve. You know, nonprofit contractors have had to pivot really quickly to provide services in a different fashion, primarily via telehealth. And this has had wide-reaching impacts on business models of the agencies we represent, from the financial structure to simply how services are delivered.
Yeah, it's been difficult. I know, Cherie, you're interested in the survey that CBHA has done recently. Do you want to talk a little bit about that or discuss that?
Thanks, Kevin. Leondra, I really applaud your organization for reaching out to those community-based providers and, you know, taking the pulse of how they're feeling about the COVID-19 outbreak and how it's impacting their ability to provide services to the thousands and thousands of people that your organization serve. Can you just tell us a little bit about that survey and the outcome?
Certainly. So, you know, we've been so fortunate to have member agencies who continue to deliver quality services despite the incredible financial burdens they're encountering. So our members have continued to take the whatever it takes approach to serving clients. They've shared harrowing stories of really putting themselves in harm's way to ensure that clients are receiving the help they need. And our survey results illustrate this. So for example, we found that 89% of the respondents cited that they had a lack of necessary personal protective equipment, including masks, gowns, hand sanitizer, and gloves. 74% said they had fewer staff available to just get the work done. And much of this was due to staff who had caretaking responsibilities at home for other folks in their lives, or maybe they had COVID-19 symptoms or diagnoses that they had to tend to. They were sick themselves. You know, our agencies are experiencing a lot of reduction in revenue. So 52% of respondents said that they're serving fewer clients, and the duration and the frequency of services provided has decreased significantly. And of course, in turn, this decreases the revenue to the organizations. Unfortunately, many staff have been furloughed and laid off. 32% have already instituted furloughs, 10% have laid off staff, and 14% are making plans to furlough or lay off staff. We are in dire need here. You know, these are really alarming statistics, but it's the reality for our members.
Now, Leondra, your organizations serve like up to 9,000 people a month. Is that an accurate number?
So depending on the organization that's a member, it could range from a few thousand to tens of thousands of folks. And we saw that in our survey. So of the folks that provided services within the survey respondents, we found that there was an average of 9,000 individuals that were served per agency.
And how are your members coping with these challenges and these difficulties, just in terms of a lack of resources and the extra workload?
really difficult for our members, but again, they're really adopting the let's do whatever it takes to provide services to our patients. So a lot of them have utilized telehealth. Many of them are still out in the field providing services just about vulnerable populations. So for agencies that serve homeless populations and others, or maybe older adults that don't have access to the technology, who can't engage in telehealth, they're physically going and providing the services, even when they're short-staffed. Coping is difficult. These are behavioral health professionals, and so in many ways we're the experts at this, but they're under stress too, stress in their own personal lives, as well as the stress of adapting to the challenges that are presented to them as they provide services to the very vulnerable clients. So it's been difficult, but it's also provided an opportunity for our organization to step in and provide resources and to do the advocacy on behalf of our members. And the survey is just one way that we did that in order to really capture their stories and share it with the world, really.
And of course, one of the difficulties that everybody faces is we don't know yet, it's still too early to know yet, because of the nature of the infection rates, when we're going to see a relaxation of the shutdown rules, the stay-at-home rules, the social distancing. Sort of a simplistic question, but if you could take a magic wand and wave it, what's the one thing that you would like to see done that would really help your members?
Well, simply, everyone needs funding, and as soon as possible. We've been advocating at the state level for counties to work with our agencies who contract with them for as much flexibility as possible in the contracting relationships and arrangements that they have to allow for more immediate cash flow. So we've been successful in partnering with about 20% of California's counties to provide some upfront funds to help keep the literal and the virtual doors open, so to speak.
Leondra, can you talk a little bit more about what's sort of happening at the local, state, and federal levels to help strengthen our core public behavioral health safety net?
Sure. So, we're really proud to partner with the County Behavioral Health Directors Association and the California Alliance for Child and Family Services to recently request $100 million of the state's SB 89 funds that would help to bolster the behavioral health safety net system. So we are strongly advocating for this, and we hope that we see some success there. We've also advocated to the governor's office to build in flexibility for licensing and training requirements for behavioral health professionals. And the governor has responded by issuing an executive order that would allow licensing boards to keep licensees working in the field and bring recently retired licensees back to provide emergency services. At the federal level, we've mobilized our members and joined the National Council for Behavioral Health in a campaign to request $38.5 billion to support behavioral health agencies during the pandemic. So we've written letters to Congress, we've submitted op-eds to local papers. Just yesterday, we had a few different member agencies participate in radio interviews in the Bay Area, where they were sharing their stories about the work that they're doing, during this pandemic. And we've also lobbied the Federal Reserve to provide funding for our member agencies who have over 500 employees, because with some of the loans that the Federal CARES Act offered, many of those only applied to businesses with less than 500 employees. So we've done whatever we can to make sure that the voices and the stories of our member agencies are told at the local level, at the state level, and at the federal level as well.
So do you, in the immediate time frame, do you feel we're running out of time? And with the tsunami of need that we know is going to follow once the stay-at-home orders are lifted, are we running out of time?
Oh, Cherie, yes, we are. The implications are dire. If our members do not receive the support to keep their businesses in operation in order to serve clients, we'll have a worse workforce shortage problem than we had before the pandemic. And the pandemic is creating conditions that could possibly lead to more individuals who will need our member services. So for example, isolation can lead to or exacerbate depression, anxiety, and poor coping mechanisms such as substance abuse disorders. We know that there have been a number of youth suicides that have already occurred during the pandemic. And for those who have COVID-19 or even just have a family member who does, the experience of receiving treatment or witnessing a sick relative that in itself can be traumatic. So we need a well-funded and supported behavioral health safety net system that's prepared to deal with the aftermath of this pandemic. And if not, as you very well know, Cherie, many will turn to overburdened hospital emergency rooms across the state, merely just shifting the pressure from one part of the healthcare delivery system to another.
Are we seeing permanent damage to the safety net?
I hope not. I hope it's not permanent. My hope is that we can do what it takes at the state level, the federal level can help us as well to really get the finances in order so that the safety net can continue to be intact. I'm crossing my fingers. Maybe I'm naive there, but I am hopeful. And when I look at what my members are doing and, you know, really the mission of their organizations and how they provide services, I know that there's hope there. I know that we can survive this, but we do need the cash flow. We do need the finances. We need the support in order to continue to provide the services.
Well, and as you just described, CBHA really, in many respects, its members are on the front lines of dealing with this issue, this pandemic, and the impacts. Are there any inspirational stories that you've heard that you perhaps can pass on to us that folks are doing that are really going out of their way above and beyond?
You know, that's really tough because so many of our member agencies are doing whatever it takes to keep their clients whole. So when we conducted our survey, we asked our members to share stories that captured their experiences during the pandemic. And the one that comes to mind for me is, you know, when telehealth was not a viable option for one agency that provides services to older adult clients, the staff decided, you know what, we're concerned about, you know, getting our therapy session done, but these folks need groceries. And so what staff members did is out of their own time, they went to stores and they bought 2 months of supplies and groceries for every client. They dropped them off on their doorstep and then they knocked on their windows and they conducted therapy sessions and check-ins via their windows. They took care of their immediate needs. They made sure that those folks had food and then they took care of their mental health needs. That's the type of work that our members are doing. That's the type of commitment that they have. And I think that really illustrates the commitment that they have to over 500,000 clients that they represent collectively.
So, Leandra, the behavioral health community by and large is a very resilient community. We deal with a lot of adversity. The delivery system has been underfunded for a very long time. It's a very fragmented delivery system. Your organization, representing the critical safety net part of our delivery system, needs resources, needs information. So where should these organizations go today and tomorrow and in the future to get the information and the resources that they need to continue moving forward in delivering care in this COVID-19 environment?
That's a great question because, you know, there's so many different sources of information out there, especially during a pandemic. Everyone wants to help. Everyone's throwing out information. You know, I've seen 5 million webinars, fact sheets, and it's great because those are very helpful to the community. You know, we're getting guidance from the federal level, the state level, counties, and national and local organizations. You know, CBHA obviously really aims, and our mission is to be a resource for our members and others in the community. We partner with national organizations as well. So the National Council for Behavioral Health, you know, provides a lot of resources, and we are able to work with them and pass that on to our members and others. And we really hope that that's been helpful, that federal level advocacy in collaboration with the state level advocacy. And when we think about, you know, the impact of this pandemic on patients, particularly those who take behavioral health medications, CBHA is able to assist in the sense that we manage California Access Coalition, and it's become a resource because it has stellar patient advocacy members, including NAMI and the Depression and Bipolar Support Alliance, who've also provided several resources. So overall, despite it all, within the behavioral health community, there's a lot of advocacy organizations that are working to help people cope and thrive during the pandemic. So I'm hopeful that we'll continue to all use this multi-pronged approach to bring together all of the different advocacy efforts, all of the different resources and information to educate our members and educate the community about what's happening.
Well, we certainly know that the new budget, when they put it together, is going to be heavily focused on funding the impacts of COVID-19. You talked earlier about the need for greater resources. So if we could, let's close this out with some final thoughts from you, Leandra, on the need for those extra resources and what you'd like lawmakers and the governor to think about.
Sure. You know, without a stable safety net, there are going to be hundreds of thousands of Californians who can't get the help that they need. You know, behavioral health providers are really critical. They play a critical part of the healthcare delivery system. And I think that if nothing comes out of this pandemic, what we will know is the story of clients who need help, the story of providers that are working so hard to provide that help. I hope that that is what is impressed upon folks, and the ability to bolster together, to come together and provide funding for this critical safety net system will really make the difference. So I do hope that among all of the competing priorities for funding, that the behavioral health service system and the providers are able to be funded and taken care of so that they can continue to in turn take care of the many clients that benefit from their services.
All right, Leandra and Cherie, thank you both very much.
Thank you.
You're welcome.
And thank you in our viewing audience. Rising to Meet the Moment is a production of Behavioral Health Action, a coalition of more than 50 statewide organizations united to raise awareness about behavioral health issues in California. Thanks for watching.